Well, hello there, everyone. My name is Dr. Jeff Schroeder, and I'm going to be your instructor for your next course, which is Evidence-Based Practice NU602. This course will build on the knowledge that you've already gained in which was most likely your previous course, NU601, and that was where you learned about all things nursing research, qualitative and quantitative. And so what we do in this course is we take that knowledge one step further and we discuss how we apply that knowledge in evidence-based practice. And this is important for any of you that are going to be nurse leaders, nursing educators, or anybody that's going to be involved with determining what the future of our nursing practice is going to be. Each week I will be doing a video introduction for you. I started doing these a few modules ago. I've gotten good feedback on them from students so far, and so I've decided to basically just keep up with the process of doing these video introductions. And in the video introduction, I'll be reviewing the previous week's learning, uh, giving a summary of what the discussions were, and getting us back on track anywhere that we need to be, or adding clarification as need be along the line. As you have questions in the class, or as you have anything that you want me to discuss specifically in the weekly introductions, let me know. I'd be more than happy to do that. Um, a few course basics. Of course, you all by now are pretty aware of how these courses work. This course is built and structured very much like your other courses. We're going to have 8 weeks worth of modules. Each week we'll have a discussion question, and then in certain weeks there will be other assignments, and I'll be covering those assignments as we really get to them. A few other basics because these always come up as questions. Um, when are the discussion questions going to do, or excuse me, when are discussion questions responses due? In each week, discussion question responses will be due, the initial responses will be due by Wednesday at essentially midnight Eastern time. I'm not really big on the midnight. I personally live on the West Coast. I'm in California and spent some time in Arizona and even some time down in Mexico. But I'm basically here on the West Coast. So those of you on the East Coast, which is most but not all of you, um, most of you are used to that midnight time, which for me is 9 p.m. If you're somebody who works late night on a Wednesday night, doesn't get home until close to midnight, don't fret. If you post at 3 o'clock in the morning, I will not be counting that post as late. Really anything, a few hours up till maybe the morning after a discussion response is due, I'm pretty good with that. I will not generally count that as late. However, anything over a day late, certainly over a week late, that will be deducted points as discussed in the syllabus. And then your responses to peers are always due on Saturday night. Sunday's kind of an off day, and Sunday's usually the days when I record these weekly announcements, and that's usually the day when I also do my grading for the week. So just to kind of let you know that that's going to be sort of the format for the class. I encourage you to watch these videos every week because I will be giving guidance and I will be giving some tips for success. This course is a little bit tricky in that each week, and starting in week 1, we're going to be um, after you do the readings and after you review the PowerPoints, we're going to be tackling this thing called, you're going to be completing a PICO. P-I-C-O, and then actually it's a PICO with a T. And what exactly does that mean? And in week number 1, you're going to be identifying a clinical issue or problem of interest, anything within your nursing practice that you have found to be an issue that might be worthy of examination for what would be the best practice to implement to improve this particular problem. As you're doing your week 1 PICO, and as you're identifying a problem, remember, this isn't a patient-specific problem. This isn't one patient that you found that has a problem. This is something that you've discovered in your nursing practice overall, either a policy and procedure or some sort of a practice guideline that you have in your workplace that seems like it might be behind the times, or whether you're wondering whether or not there may be a better way of doing things. And so you're going to identify a problem of interest and then do a very basic search, finding 1 or 2 articles that might support in the nursing literature that this is a topic that has been discussed somewhere or has been researched or studied somewhere. That problem should also focus on a particular population, a patient population of interest. Again, not just one specific patient. You're not just trying to identify a problem that's kind of an outlier problem with one patient, but you're talking about Perhaps you've identified that in your hospital you've had an increase of nosocomial or hospital-acquired infections, and so that might be an issue. And there may be some questions as to whether you're using the best available hygiene practices, or the best available form of hygiene, hand hygiene, or the best uh, you know precautions. Isolation precaution protocols, whatever that may be. But you're going to identify the patient population that is focused around that problem. Yeah, then to justify the significance of the topic, the nursing practice. And again, this is just something to show that it's an issue not just in your hospital, but has been found to be an issue in other places. And then identify the PICO components, which are your patients or your population, your proposed intervention, your comparison intervention, or what you're going to compare that intervention against to identify what your outcomes are going to be, and then a time frame, which is how long are you going to give that new intervention uh, time to see if it is actually affected. A very basic, a very simple PICO might be that an issue. I'll use what I said earlier. Perhaps a hospital has noticed that it has had a spike in um, hospital-acquired infections overall. And so the patient population in that particular case would be inpatients in the hospital, patients that are admitted to the hospital, or possibly patients admitted to the hospital with an invasive procedure or a surgical procedure. This is a relatively easy topic to justify the significance, because there's many articles have been written on the concept and the topic of uh, hospital-acquired infections. And the PICO would be the population, again, hospital-based patients. Intervention is what you might want to do differently. This may be a new um, education protocol for hand washing, or putting posters up and around the unit about reminding people to gel in and gel out and wash their hands before any patient contact. Whatever it is that you choose to do. And then you're going to compare that with um, something else that would be either two different educational programs. You may have to want to see which one's the best, or you may want to just compare it with your current protocol, which may be no education intervention. And then your outcomes is going to be tracking or identifying to see if over what period of time frame you have you will witness a decrease in um, your infection rates. Now again, this is a very basic, what I've laid out is very basic. You may want to do other things, and I would hope that you probably would want to do something a little bit more specific. But that is what the PICO format is. And then you're going to write the PICO question using the exact PICO format, the PICOT, in those particular in that order. Again, this isn't just a intervention towards a specific patient or one patient problem. The intervention isn't like an intervention on a care plan. We're not really doing a care plan here. We're really addressing what would an intervention be for an overall patient population. That will probably be fairly clear. If it sounds confusing at all, if you're reviewing this video before you've done any of the reading or reviewed any of the materials, it may seem a little bit confusing, but I encourage you to go back, do the reading, review the materials in the course, and it will probably become a bit more self-evident. I will be giving feedback throughout the week on your PICOs, and then next week we'll be building on your PICO to talk about how you find evidence to essentially support whatever possible intervention that that you identify as an issue within your practice. And so as you have questions, please feel free to post them in the Ask Your Instructor or in the Ask Your Instructor forum within the class. I will try to always answer questions within 24 hours. The standard here at the school is we'll always answer questions within 48 hours, but I try to keep on top of things fairly well. And again, as you have any questions, please feel free to ask them. Don't ever feel stupid about asking a question. If you feel that you have a question that may pertain to this class, please post it in the classroom. It's way easier to post one response for everybody than it is trying to post 15 individual emails about, does the format need to be this, or what about that? If you think it's a question that other people may have, do not feel worried about posting it in the classroom. I encourage you to do that. These videos will generally last no more than about 10 minutes or so usually. and I am available to talk with anybody throughout the week. I don't have posted office hours. However, if you have any questions and if you would like to arrange a phone call with me or even a video conference, there's many ways that we can do a video conference. I'm more than happy to arrange that. My goal is to make this as useful and as great a learning experience as possible. I will be responding also to your welcome messages in the class. I'll be posting a little bit about my bio. And I noticed that there's a few names in the class that I recognize from previous class, so it's good to be with everybody again. I hope that we have another great experience, and I look forward to seeing you in discussion questions. See you in class.